Virtual reality in medical education. What is virtual reality? Virtual reality means feeling the imaginary virtual world, rather than real one. The imaginary world is a simulation running in a computer. Virtual reality is a term used for computer-generated 3D environments that allow the user to enter and interact with alternate realities. What is virtual reality? In other words, virtual reality is a computer-generated world with which user can interact. Interaction can vary from looking around to interactively modifying the world. Types of virtual reality. 1. Fully immersive simulations. Chances are when you think of VR, you're picturing a fully immersive experience, complete with head-mounted displays, headphones, gloves, and maybe a treadmill or some kind of suspension apparatus. Types of virtual reality. 2. Semi-immersive simulations. Semi-immersive experiences provide users with a partially virtual environment to interact with. This type of VR is mainly used for educational and training purposes, and the experience is made possible with graphical computing and large projector systems. Types of virtual reality. 3. Non-immersive simulations. These types of experiences have become more advanced in recent years with video games like Wii Sports, where the system actually detects your motion and translates it on screen. Components of virtual reality systems. VR system is made up of two major subsystems, the hardware and software. The hardware can be further divided into computer or VR engine and I/O devices, while the software can be divided into application software and database. Virtual reality system hardware. The major components of the hardware are the VR engine or computer system, input devices and output devices. Virtual reality system software. Virtual reality system software is a collection of tools and software for designing, developing and maintaining virtual environments in the database where the information is stored. The tools can be classified into modeling tools and development tools. Application of virtual reality. 1. Virtual reality in military. A virtual reality simulation enables them to do so but without the risk of death or a serious injury. They can reenact a particular scenario, for example engagement with an enemy in an environment in which they experience this but without the real-world risks. Application of virtual reality. 2. Virtual reality in engineering. This technology enables engineers to view their project in 3D and gain a greater understanding of how it works. Plus they can spot any flaws or potential risks before implementation. Application of virtual reality. 3. Virtual reality in entertainment. The entertainment industry is one of the most enthusiastic advocates of virtual reality, most noticeably in games and virtual worlds. Application of virtual reality. 4. Virtual reality in surgery. This technology enables trainee surgeons to gain valuable experience but in a safe environment. They learn skills and techniques without causing harm to patients and receive constant feedback as they do so. Pros and cons of virtual reality. Pros. Virtual reality creates a realistic world. It enables user to explore places. Through virtual reality user can experience an artificial environment. Great for training. Cons. The equipment used in virtual reality are very expensive. It consists of complex technologies. Prolonged usage may cause psychological or mental stress. In virtual reality environment we can't move by our own like in the real one. Augmented reality. Augmented reality is the art of superimposing computer-generated content over a live view of the world. Augmented reality integrates digital information with the user's environment in real time and is becoming more accessible and affordable for medical education. The key components in the AR devices are sensors, cameras, projection and reflection. Augmented reality. Augmented reality is differentiated based on its implementation. A. Marker-based augmented reality. Uses camera and few visual markers like QR codes. It uses camera to distinguish markers from the real-world objects. Unique and simple patterns like QR codes are used as markers, because they are easily recognized. Augmented reality. Augmented reality is differentiated based on its implementation. B. Maker-less augmented reality is also known as location-based or position-based augmented reality. It uses GPS, digital compass, velocity meter or accelerometer to track location which are embedded in the devices. Extensive availability of smartphones and location detection features provide strong force to marker-less augmented reality. Augmented reality. Augmented reality is differentiated based on its implementation. See. Projection-based augmented reality works by projecting artificial light on real-world surfaces. It also uses laser plasma technology to project 3D interactive hologram in air. Augmented reality. Augmented reality is differentiated based on its implementation. D. Superimposition-based augmented reality replaces the original glimpse of any object with new augmented object either partially or completely. Application of augmented reality. Dentistry. Our software built into smart glasses superimposes real-time data directly from a dental scanner, enabling a dentist to build precise crowns or caps. Application of augmented reality. Training nurses. AR-enabled, tablet-based simulations of different patient scenarios allow nurses to better connect with patients, for example, SimMan, and handle daily work situations requiring a combination of social, technical, and team skills. Application of augmented reality. Medical imaging. AR enhances visualization of CT or MRI data by superimposing stereoscopic projections during a surgical procedure. This information is vital in surgeries requiring precise navigation to a particular organ. For example, AR can be used for preoperative planning and enhances accurate localization of tumors and surrounding structures for performing procedures. Application of augmented reality. Medical education. Professors leverage AR to educate medical students on basic anatomy and concepts. Doctors use it to learn about new therapies and drugs. AR Anatomy, for example, uses an optical character recognition app to access textbook images and overlays digital information on human body structures to help students learn the names of bones and muscles. Its goal is to replace bulky textbooks and charts. Mixed reality. Mixed reality is more forward-looking in the medical community. Mixed reality is a combination of AR and VR features that mixing real and virtual environments to create a completely new environment. MR is based on the AR, providing a more realistic and highly interactive experience than the AR, interacting with virtual objects through real hands. Application of mixed reality. MR mannequins. The mannequins used in training act to be real, but it's still a dummy. The trainees would not get the actual feel of the exercise, and that is where MR comes into picture. The image recognition of MR translates the dummy into a real person. Application of mixed reality. Teaching anatomy. It is not possible for medical professors to provide the actual specimens to study to the students. The MR technology can provide the real specimen to each student to study in detail. The students study with a real heart and can actually view each and every veins of human body and learn about each part of it. Application of mixed reality. Pharmaceuticals. The MR technology can be effectively used in development of drugs. With the help of MR, the pharma students can actually have a look at how a particular drug reacts in our body. As the technology advances, the students will also be able to see different reactions of different medicines in different situations of our body. Application of mixed reality. MR surgery. The surgical training can be made more advanced and effective with use of MR technology. The students can operate on the fake specimen and get the feel of actual surgery reactions from the specimen.